Hello from Oslo, and welcome to today's afternoon tea conversation. My name is Ingeborg, and I'm the leader of Women in Global Health Norway. With this series, we're highlighting some of our members, and today I'm having a chat with Marie Louise Sunde. Marie Louise spoke on the very inaugural launch of our network in 2018, and I'm happy to report that she's now part of our advisory group. She's a surgeon by training, the founder of at Hun Spanderer and co-founder and COO of Equality Check. And she has co-authored a best-selling book on gender stereotypes. I could go on for a long time. She was also a leading voice during the medical movement. So really happy to see you today, Marie Louise. So welcome.
Thank you, and thank you so much for having me. I'm very glad to be joining the afternoon tea.
Good. You have a medical background and you're a surgeon by training, now very far from patient care. So to start off and give our viewers some insight into your good self, could you tell us a bit about the roads you've traveled and the personal history that led you where you are today?
Yes, of course. So yes, I am a surgeon by training, and that was that has been my big passion for the past 10 years. So ever since I started med school, actually, surgery was it was very clear for me that surgery was the path that I was going to go in. So I spent most of my time, I skipped lectures to follow surgeons and shadow surgeons and spend time in the OR and the ER and just to learn as much as possible. So that has been really my big passion, and I love the combination of being very hands-on, solving problems with the more medical approach, and some surgeries is very advanced as well. So you have to combine both the academic and the more hands-on approach, which was very appealing to me, and also kind of the tone in surgery, which is very. I used to be a dancer at the Royal Ballet School. So the tone is quite similar. So it's very, you have to perform when you're on stage. It's quite a direct tone. You're being told if you're not good enough. You're being told what to improve. You're not as much being told if you're doing well, but that's you're being. It's very direct and it's tone where the goal always is to improve and improve. So that was very appealing to me. And then I started out with research in med school. Which ended up in a PhD within colorectal surgery, IBD surgery. So that was really my big passion. And if you asked me 3 years ago if I thought I would quit, I would definitely not think that. So that was a big surprise for, I think, both me and my surroundings. But also it's my other big passion has been equal rights, women's rights, human rights, diversity and inclusion. So I've been very engaged in that as well on the side. And through the international work, I was invited to the UN back in 2014 when they launched the He for She campaign in New York, where Emma Watson gave a speech that has become very famous.
Yes, I remember being very impressed by that. Yes.
Yeah, and some look at it or call it sort of the beginning of the fourth feminist wave. And she said a lot of things that was very inspiring, and one of them being, if not now, when? If not me, then who? And at that time in 2014, gender equality was not really on the agenda. And at least in the Western world, and maybe especially in Scandinavia, we had the feeling that this is something we've achieved. And being a young surgeon in a very male-dominated field, it was very obvious for me that this is not something we've achieved. And so that's when I also started working with diversity and inclusion and unconscious biases more as a sidekick in the beginning, and that's what I'm doing full time now.
Well, that's so interesting. I have a ton of side questions here, but I'm going to try to keep on track because otherwise I think we could spend 2 hours together today. Could you be more specific on what you're currently involved with and tell us a little bit more about the equity check and why this is so important.
Yes, absolutely. So what I'm doing now full time is working as CEO of Equality Check, which is a company I also founded 2 years ago. So I quit my job in the hospital 2 years ago to start working full time with Equality Check. And the story behind there is that we saw through the work that we did with so after 2014 and the Emma Watson speech, I wanted to address more unconscious biases. So I started more of a social movement that we called Hun spanderer, addressing unconscious gender stereotypes, especially in the workplace, which went really well. And so we became advisors for ministers and the government and C-suite executives, and started to see a lot of trends, which were, I think for me, coming from more of a medical and scientific point of view, surprising and even astonishing to see the lack of evidence-based approach, the lack of data-driven approach when it comes to diversity and inclusion. All these myths and biases and stereotypes that we have, that if this was medicine, it would be a catastrophe the way companies have been working with this without having a diagnosis or having an evidence-based treatment. So I saw a huge potential in being able to do that a lot more effective with the right kind of data and more evidence-based solutions. And we also have seen, especially the past couple of years, a very increase in stakeholder demands in how employees are starting to become more and more important and understanding their rights and having more demands towards the employer, which I think is really good. And that's also an inspiration working in hospitals in Norway. We all know that the working conditions aren't great, and the hospital as employers aren't very keen to improve the conditions for the employees. So that was also a big inspiration. So seeing all these things, I then quit my job 2 years ago to found Equality Check, which is essentially a company where we call it a TripAdvisor or Trustpilot for equality in the workplace. So it's an open platform where all employees can anonymously review the things we know employees care the most about today. So future potential, equal opportunity, work-life balance, unconscious bias, etc. And then we cover the full diversity spectrum. So then when 5 people have reviewed a workplace, it goes live and everyone can see what it's like to work there, broken down on these data points. So this is a great way for employees to contribute with data, with transparency, to catalyze change, to nudge change through that transparency, because we're lacking a lot of transparency on these topics today. And also for the employers, we're helping them with the insights and the data to help them diagnose what are their problems, and then suggesting evidence-based solutions on how they should improve.
That's interesting, and I'm sure that all of what you are talking about and the evidence that you're collecting would be a real surprise for many very young people. I myself have 3 daughters, and we do tend to believe, as you say, that we have a fully equal society.
Yeah, definitely, and we don't, and we're starting to gather quite a lot of data now from Norway, and starting. And I think that the good thing about Equality Check is that we can actually start to make the more unconscious and the differences that have been hard for people to identify, and that has been more of a feeling, but that's so easy to rationalize away or find other explanations for it. We're starting to have now tangible data to show that, well, we actually do see that women are 60% less likely to see equal opportunity in the workplace, for example, or we do see that people with an ethnic minority background are 50% more likely to hear jokes or negative comments about the group they belong to, etc. So it's I think this is the only way to start making those hidden obstacles more tangible, so that employers can start act on them.
Absolutely, and also a good tool to use when you are applying for at least public funds.
Yeah.
Absolutely. So you're also involved in a number of other organizations and networks through leadership roles and board membership. What role does these networks play in your professional life?
I think they do a great deal because most of them are intertwined in some way, with the main focus being diversity and inclusion, women's rights, women's health, etc. And very often these topics are connected. And so I think it's a good way to both to learn and to be able to be a bridge between different sectors where there might be very important synergies.
Absolutely. Are there any defining moments in your life that you feel shaped you as a leader?
I think it's hard to say very specifically. I think there are some with obviously there have been a lot of episodes in the hospital where I think as a leader it has shaped me in two ways. One of them is being a surgeon, you are very often in charge of situations that can be sometimes dramatic, and sometimes you have to make decisions very quickly. You have to, you don't always know enough about the situation before making them. So you get sort of comfortable, or at least used to making decisions and having responsibility, which I think is very helpful in all kinds of leadership careers. And I also definitely have a lot of more observations from the hospitals, which are more in the sort of how not to be a leader, because there's a lot of the leadership in hospital is it's a very poor kind of leadership, and it's a very from the management, it's a lot of power abuse towards employees. So I think that has been an inspiration, sort of the opposite way, in trying to create a culture in our company that's very different from that.
Yeah, absolutely. With the pandemic now, many things have changed for many people. How has your work changed during the COVID-19 pandemic?
It's a very good question. I think the interesting part of that question is that this is so different for different kinds of people. So I had already quit my job in hospital before the pandemic. And so my life has been very differently affected by it than my good friends who are still in the hospital. So it's been both positive and negative outcomes of it. I think that the hard thing for us has been, we're a startup. We had been live as a company for about 6-9 months when Corona started, and so the good thing for us is that we're a 100% digital company, so everything can be done technically from home. So for our team members to work remotely, that's it's not a problem. I think that the difficult part is that building an organization and scaling an organization from scratch when everyone is working in different locations is really hard, and building that team and getting that same sense of knowing where you're going and developing myself as a leader as well has been definitely challenging with the situation. And initially it was especially also challenging because the market was so nervous. I think that normalized after 6 months-ish. So that's easier now. But I think the good thing is that we're learning to build a company and learning. You have to improve the communication skills. We have to be even more structured because we're all working remotely, and that's positive. But it's also harder to build a team. And we've had many new people starting during Corona. So that's definitely a challenge. So it's sometimes I envy my hospital colleagues that get to go to work every day and have that sort of routine still. And then still, it's I do not envy some of the situations or the workload or the pressure that they have been throughout the year, of course, as well.
No, although I can appreciate that you, of course, miss your patients, I'm sure.
Yeah, definitely.
Yes.
It's about a clinical life.
So what attracts you to Women in Global Health in particular as a movement, and how do you see a place for a network like ours here in Norway? I mean, to a certain degree, you've already responded to a lot of that.
I think it's super important, and I think the whole topic on women in health and the healthcare sector towards women is very important. It's an area that has been vastly undermined for so many years in so many different levels. And we're starting now to have more and more conversations, both on the kind of just how symptoms can be different for women, which leads to misdiagnosis of more women, how classic female diagnosis have been under prioritized and is not really a topic. Today, the Minister of Health recently said that now they're going to prioritize endometriosis, which is great. But it's also it's one female disease, and it's just the tip of the iceberg. So it's so I think focusing on that is super important. And also, which is something that, of course, interests me a lot, is not only those things, the obvious women diseases or how women present differently with diseases, but also the unconscious bias that is within medicine and how we treat men and women or people with other ethnic backgrounds differently without being aware of it. And that can be as there's a lot of studies showing, for example, something that we wrote about in our book, how doctors tend to see pain symptoms from women as less severe. So men are more often they get seen by the doctor in the ER significantly sooner compared to women. They get more painkillers compared to women. We just have this stereotype without being aware that when a man cries out in pain, that's really serious. This is something we really have to attend to right now. He's obviously very sick. And when a woman does the same, we're more like, yeah, she could be exaggerating. It doesn't necessarily have to be this bad. So we have all these stereotypes in how we also treat symptoms and treat patients, which I think is important to highlight as well. And I think that's also a conversation that has been revisited now in terms of the ethnic differences and how we also have a lot of biases there.
Finally, to our viewers out there, what would you like to say to your younger you, Marie Louise, words of wisdom that you would have liked to hear yourself when you started out?
Yeah, that's also a very good question. I think I've always been very determined and goal-oriented, which the good thing about that is that I've done a lot of things and you know, and that's great, but it's also it's been a lot of work, and it's been sometimes I've been very focused on the goals. So I think maybe sometimes also not being that focused on the goals, and sometimes looking more around as well, and knowing that you have a long life, and so you don't have to achieve everything initially always. So maybe that's a goal, and I think or an advice. I think also just trusting yourself and trusting your instincts is good advice, because, and that's something that I think has been very maybe more and more obvious for me, especially as I've been facing situations or leading discussions that are not always popular, or that sometimes where if I have a new angle on things or trying to solve things a different way, that's not always, you don't always get the best response initially, but then as people adapt to it, then at some point this is the, you know, the average, or everyone agrees this is what it's like. So I think also trusting your instincts and sticking to that is good advice.
Thank you. With a bucket full of good advice, I'm going to thank you for sharing a little bit of your story and interesting reflections with us today, Marie Louise. It's a great pleasure to have you in Women in Global Health Norway, and I'm sure looking forward to more collaboration in the times ahead. So thank you so much for everything you're contributing to us.
Thank you so much for having me.
Thank you to our viewers for tuning in. Welcome back.